Hello friends, in this lecture we would learn about the basics of meta-analysis. I will focus mainly on how to understand any meta-analytic studies, how to do meta-analysis that we will take up in subsequent lectures. So first of all, let us understand what is meta-analysis. So meta-analysis is nothing but the statistical synthesis of the result from a series of studies to find meaningful conclusive summary. What it means that many studies are published studying the similar research question. One study is published in one part of the world, another study is in another part of the world. Meta-analysis is basically combining the findings of all the studies and find out the summary findings. And the summary findings, or what we call it the summary effect, is generally obtained by different predefined statistical methods so that it has a value and it actually represents the true population summary of the effect. So in a way, it's a combining of different research aspects to see whether they are dealing with the similar effects, different effects, what is the combined effects of all the research, and if they are dealing with different effects, why they are dealing with the different effect, why one population is giving one kind of effect and another population is giving another kind of effect. In another way, if one population to answer any research question, is the answer is similar for one population and different for another population, what is the crux of different answers, and if the answers are different, why they are different, and if you apply statistical methods in finding out that, it becomes meta-analysis. Statistical procedure used in meta-analysis can be applied to any set of the data. The synthesis will be meaningful only if studies have been collected systematically. So for any meta-analysis, it starts with collecting the studies. If you collect only selected studies, what will happen? Your meta-analysis research will be biased. So you cannot do any meaningful meta-analysis without systematically reviewing the literature. All the parameters of how a systematic review is performed has to be there and has to be the first step for doing any meta-analysis. Now, if we look at little bit of history, the Carl Pearson was probably the first to combine data from different studies to study efficacy of typhoid vaccination. And Glass was the first scientist to name this method a meta-analysis in 1978. Now, if a treatment effect or effect size is consistent across the series of studies, these procedures enable us to report that the effect is robust across all the population. Answer to my research question is similar in all the population. That means this must be the right answer. This answer can be applied to the world population. If I do a research study in India, it gives similar answer. If I do a research study in US, it gives similar answer. If I do research study in males, it gives similar, right? If I do the research study in females, it gives similar, right? Answer. So basically the answer remains same for everybody if some effect size or treatment effect is similar across different studies, right? But if the treatment effect varies across the studies, between the studies, if say for example a study conducted in India gives different answer but study conducted in US give different answer, so there is a variation in the study. So this variation is known as the heterogeneity, and there are specific statistical procedure in meta-analysis to know extent of this variation and to analyze why this variation occurs. Is there any different confounding factors between the two studies? Whether the confounding factors affect the final effect size, and that's why we are getting the different effect size. This process are known as the meta-regression. So basically heterogeneity to start with is the measure of variation between the effect size and in meta-analysis. Now, what is narrative review, what is systematic review, and what is meta-analysis? See, narrative review is like that I believe that vaccine don't work. So what I will do? I will try to find studies which support my belief or support my bias, and write a long article stating only 5 or 10 studies. There can be a 20-25 studies showing benefit of vaccine, but I ignore them. And I combine those 5 studies, write a review, and present that vaccine don't work. So that is basically what is known as the narrative review. So basically, narrative review is done by individuals. Strategy can be anything, and conclusion are just author's judgment. It may be true, may not be true, and there are very high chances of bias. What is systematic review? Systematic review is generally conducted by a team or minimum 2 authors, so that they discuss if they disagree with each other, and what point they disagree, why they disagree, everything should have to be mentioned. They need to form a search protocol and try to search every studies they can get, and then start evaluating all this study, try to come to a conclusion. That is known as the systematic review. Now, issue with systematic review is mathematical formulas or statistical formulas, statistical steps are not applied. It is still a conclusion of the team of that authors. So, the conclusion is qualitative but not the quantitative conclusion. We cannot find summary of effect size, if any association are there, how stronger are those associations. So that is known as the systematic review. Now, meta-analysis has systematic review as the first step. You have to collect all possible studies by method prescribed in systematic review, and then you analyze them quantitatively, applying mathematical formulas, applying mathematical principles, and find a quantitative effect size. So that is meta-analysis. Meta-analysis gives us final effect size. So meta-analysis works with effect size from each study. It does not take p-value from different studies and find that this study shows significant result, this study shows significant, that was summary of effect is significant. No, it takes the effect size. For example, odds ratio or risk ratio. This study has risk ratio of 0.8. That means that 20% protective. But another study is a risk ratio 1.1. That means 10% more risk for any factors. But the summary, combining all such study, we get the summary risk ratio of around 0.9. That means the intervention is protective. So that is basically a meta-analysis. It deals directly with the effect size. Effect size can be risk ratio, it can be odd ratios, it can be means, population mean, comparing the mean, it can be mean difference. Any effect size you can take. It can be just a percentage in proportional meta-analysis. It can be sensitivity, specificity in diagnostic accuracy meta-analysis that we will study in subsequent slides. It includes all the effect across different studies in a single statistical synthesis to produce a summary of effect. It allows us to assess dispersion of effect, right? So basically, and also dispersion is nothing but the heterogeneity. Why there is a different effect size or variance across the study? It allows us to study that, and it also distinguishes between real dispersion. That is, there are factors which are responsible for difference in effect, or this effect is just by chance. That is known as the spurious dispersion. Now, types of meta-analysis. There are mainly 3 types of meta-analysis. One is comparative meta-analysis, where we compare the study participant with control participant. We combined all the studies which compare for example, vaccinated individual, non-vaccinated individual. What is the risk of COVID? right? So that is known as the comparative meta-analysis. Here we take odds ratio is the effect size, risk ratio is the effect size, or sometimes mean difference. What is the difference in mean of say study participant and control participant? Another type of meta-analysis is also known as the diagnostic accuracy meta-analysis. Here we need to test the accuracy of any diagnostic test. So, what are the parameters of finding accuracy of any diagnostic test? Sensitivity, specificity, diagnostic odds ratio, area under curve, positive predictive value, negative predictive value. So, here the summary effect in diagnostic accuracy meta-analysis would be pooled sensitivity. Pooled is we collect the sensitivity from each study and find the summary sensitivity. That is known as the pooled sensitivity. So, pooled sensitivity, pooled specificity, pooled area under curve, pooled diagnostic odds ratio, pooled positive and negative predictive value. Now, third kind of meta-analysis, it is also known as the meta-analysis of proportion, or sometimes we call it the prevalence meta-analysis. For example, if you want to study post-operative acute kidney injury, what is the percentage of it? Now, here we take different studies showing the percentage of post-operative acute kidney injury. Are percentage similar or different? Or there is a heterogeneity between the finding. Why there is a difference? Are one cohort of one study included more high risk procedure, another study less high risk procedure? So, those are known as the factor responsible for heterogeneity. So, meta-analysis of proportion is take proportion or percentage as its effect size. Now, let us see three type of meta-analysis from my own published studies. I took that so that there is no conflict of interest problems or copyright issues. So, this is the study we published in Indian Journal of Surgical Oncology. Here we compared the morbidity and mortality between laparoscopic and open group and find the summary of effect in whether it is similar of or different between the two groups. So, here we took odds ratio as our summary of effect, right? So, this is one of the thing of comparative meta-analysis. Now, this is another our published study where we studied the postoperative serum PCT level or procalcitonin versus C-reactive protein as a marker of postoperative infectious complication in pancreatic surgery. So, here we took how sensitive day 3 or day 5 procalcitonin in predicting the infectious complication. So, here we found the pooled sensitivity, pooled specificity, positive and negative predictive values, area under curve. Here you can find that. So, this is an example of diagnostic accuracy meta-analysis. Now, example of proportion meta-analysis. Here we just wanted to study what is the post-operative mortality after liver resection. We combined all the studies published mentioning the post-operative mortality and find out the pooled mortality ratio after liver resection. And in this study, we also did the meta-regression analysis. That is the factor responsible for heterogeneity or so indirectly factor responsible for different mortality across the study. Some may used more complex patients, some whether open and laparoscopic and different in mortality, whether major liver resection versus minor liver resection, any difference in mortality. So, those are the various confounding factors. So, whether confounding factors were responsible, whether they were independently predicting the heterogeneity across the study or difference in mortality ratio across the study. So, this is the example of proportion meta-analysis. Now, let us see what is the weight of the study. Now, here we are combining different studies. right? Now, some study will have low sample size, some study will have higher sample size. So, meta-analysis use specific methods and which give more weight to the studies with larger sample size, because those are very closest to the population, world population. Sample size errors are less. So, effect produced by higher sample size should have a major chunk in summary of effect, right? But there is also a con side of giving weight to it. For example, we do a meta-analysis of 3 study. One study has 1000 patients, one study has 50 patients, another third study has a 25 study. So your summary effect will be mainly decided by the study with 1000 patients. What if the summary of effect in 1000 patient study is different from the other study? As you can see in this is the central effect. These two studies showing worse effect, but this one larger study is showing the better effect. You can see this square is represented by summary effect, and majority of summary effect is decided by this. So how to see a weight in forest plot? Forest weight of the study is generally decided by square. Larger the square, more weight of the study. And these two lines, you can see the lines. These two lines represent the confidence interval. Larger the confidence interval, less weight or less precise the finding of the studies, right? And this is a diamond shaped figure is the summary effect, and the end of this diamond represents the confidence interval of summary effect, right? As we already discussed, the length of the horizontal line representing the length of confidence interval, that gives you an estimate of how much uncertainty is there around that result. Shorter it is, more confident we are, right? Square is called the point estimate of every study. The larger size the square, more weight to the study. Bigger is that we are more confident that this study will affect our summary effect, or this effect of that particular study is more closer to the population study, right? We discussed the diamond here is called the summary estimate. It just doesn't add up the result and then divided by number of the study, but it's the weighted effect. That is, the bigger study will have a major role in deciding the summary effect rather than smaller studies, right? Left and right tips of the diamonds are two ends of the confidence interval. With each study that gets added into the plot, those tips will get closer together, because total sample size of the meta-analysis will increase. Which every study, the total sample size increase, so naturally the error will decrease. Standard error is always inversely proportional to the population size. More population, less chances of error, sampling error mainly. So our finding will be more and more precise by adding the more and more large number studies. Vertical line in any forest plot is generally near to 0, that is line of no effect. If we are doing a comparative analysis, then it is mainly whether it favors one group or another group. 0 is favors no group. That is our line of no effect. And any result which are on the summary of effect or diamond, which are on the both side of this line of no effect, will have statistical non-significant result, or it will not favor any one group. So that is the basic understanding of forest plot in summary effect. Now we will see the heterogeneity. Heterogeneity is another way of saying these things may not be the exactly same. This study is showing one effect, another study is showing the another effect. There is a variation between the effect. This variation is known as the heterogeneity. Larger the variation, that means our summary of effect, we will be less confident in summary of effect, because some studies showing this, some studies showing that. We are not sure that summary effect is really representative of the population effect. To overcome this, we generally use the random effect meta-analysis, in which we assume that the difference in effects are just random, and use specific formulas to find out the summary of effect. And we are just estimating the confidence interval, including all, considering that there are random difference between the study. So in random effect model, confidence intervals are generally larger. There are another thing known as the fixed effect model, and in that we assume that the difference in studies are real due to different in finding of effect size across the studies are within limit, and those are really due to patient factors and not just random analysis. In that, our summary of effect lies between the 95% confidence interval that we are taking. It is somewhere between that. We are sure about it. That is we known as the fixed effect meta-analysis. Heterogeneity can be caused by sampling error, or what we call it the what we assume in random effect, or there are specific factors responsible for heterogeneity. For example, studies with more liver resection cirrhotic patient will have worse prognosis than study which include the patient with less number of cirrhotic patient. In that case, liver cirrhosis will predict your heterogeneity. You need to study it by what we call is the advanced statistical method known as the meta-regression. How to measure heterogeneity? We need to really see whether heterogeneity is significant or not. There are specific statistical methods for that. That is known as the I-square statistics, or tau square, or chi-square test, which will find you the p-value, whether your heterogeneity is significant or non-significant. Heterogeneity is, again I will tell, the variance in effect size between different studies. I-square test is the probability in nothing but the probability of heterogeneity. I-square 40 means there are 40% chance that the difference in effect between the studies are due to true heterogeneity, and it is not just random heterogeneity. So generally we take I-square less than 40 is mild heterogeneity, 40 to 75 as moderate, and more than 75 the very high heterogeneity. And generally when I-square is less than 40, we took the fixed effect model. It's a mild heterogeneity. That means we assume that our summary of effect will be somewhere between the different effects shown by various studies. Tau square is between study variance. Just like there is the variance in standard deviation in mean, it is the same. But here, in case of population sample, here the in between study variance. And chi-square test, we know it will give you the p-value, whether the heterogeneity is significant or not. Whenever heterogeneity is high, you need to look for various factors responsible for heterogeneity and whether they are predicting the heterogeneity or not. That method is known as the meta-regression analysis. Meta-regression is nothing but the regression analysis that we use in normal statistics. But here we applied it to the list of effects shown by various studies. Okay, that is the only difference. With that, now let us understand the forest plot. Forest plot, first here is the various studies taken, then events, whether in your study group according to your research question. If it is the for example if it is odds ratio, it will give you the, if your interest of summary of effect is odds ratio, it will give you the odds ratio of each study. If your interest in mean difference, it is the different means across the different study. For in example, our study we published the comparing the laparoscopic versus open pancreaticotomy updated meta-analysis of randomized control trial. We included four randomized control trial published till then. Our interest was risk ratio in this analysis. You can see we took the risk ratio of various studies. There are statistical software. By just entering the event in each group, in each study, you will find the risk ratio. You can see the first risk ratio was 4.90, 95% confidence interval of risk ratio in each study, whether it is Leopard, Pedulep, Plot or Wang et al. This will give you the total effect or cumulative effect or summary statistics. So here summary statistics is my final effect size is 1.05 with confidence interval 0.36 to 3.05, right? So basically there was no difference in laparoscopy and open group. Here this is the forest plot of morbidity. So we can see that there was no difference in morbidity or overall complication rate between laparoscopic and open pancreaticoduodenectomy, right? As generally in randomized control trial, all studies, meta-analysis of randomized control trial, if your all included studies randomized control trial, heterogeneity is low because the original studies has followed the principle of randomization, proper sample size calculation. In cohort study, heterogeneity. If you took the cohort study as your study part is various included studies, then the heterogeneity can vary. But in randomized control trial, generally it is seen that heterogeneity are not that significant. Here, only 15% chance of true heterogeneity. That was non-significant. Now, this is the test of overall effect, whether there was difference between the group or not. Here you can see the summary of effect odds ratio 1.05, but confidence interval was 0.36 for 3.05. Then those who understand the basic statistics will understand that when confidence interval in both sides of the zero, generally the finding is non-significant, and that's why here p-value is non-significant. Now let us see that chart. In odds ratio or risk ratio, when we take, the line of no effect is generally 1, because we take 1 as the measure when there is no difference between the group. Anything less than 1, one group is better. Anything more than group 1, the study group is worse than the control group. Here you can see the square represents the sample size and the area is confidence interval. You can see the Pedulep has the lowest sample size. Square is very limited and its line of confidence interval is very wide. Then comes the plot. Plot and Pedulep has similar thing. Their confidence interval is very wide. Leopard has a little bit more sample size than plot and Pedulep. You can see the square is high, confidence interval is wider, but it is less than these two. And the Wang was having the highest highest sample size. Here you can see the size of the square is highest for Wang, and confidence interval is also narrow. So summary effect, you can say the most weightage is given to Wang et al. Study due to its sample size. So this is about the forest plot. This line always represents the summary effect. First p-value, this p-value is of the p-value of heterogeneity, whether variance or effect size variance between studies are significant or not, and it is not the p-value for summary effect. Then comes the p-value of test for overall effect, that is the p-value of summary of effect. Now there is another term known as the publication bias. Why this comes? Because in meta-analysis generally we take the published study. Now journal tend to publish study which gives significant finding. Nobody is interested when you say there is no difference. Oh, this treatment is failed. Whether you do laparoscopically or any surgery laparoscopically open, there is no difference. Who will be interested in that? So, studies showing non-significant findings are sometimes not published. Journals do not like that study. So, when all the studies published as having significant effect, your summary of effect will show bias towards significance, and that bias is known as the publication bias. And to overcome whether your findings are showing publication bias or not, there are specific tests known as the publication bias test. Now, generally there are two tests, funnel plot and Eagle test. Eagle test will give you Eagle's test will give you the p-value of publication bias, whether it is significant or not. Funnel test will give you the graphical view. Now, funnel plots are generally standard error versus effect size plot or inverse of standard error versus effect size plot. Here, we have shown the standard error versus effect size. Now, standard error is the inverse of sample size. So, sample size is more, standard error will be less. Sample size is less, standard error will be more. So, generally, it is assumed that the low sample size studies are more in number. Higher sample size studies are difficult to do, difficult to publish. So, these are low in number. So, majority of study, it will give you a typical funnel size. So, less the standard error, less number of studies are published, their effect size will be on the lesser side. So, it will produce a typical funnel shape plot. Now, this middle line is again the summary of effect. Now, if there are adequate number of studies on both sides of this summary line, you can say that studies were showing finding either favorable also, unfavorable also. That means you do not see a pattern of publication bias. In this study, you can see all the studies are clumped around here. There are very less studies on this side of the thing. So, you can say that there are chances of publication bias in this study, and publication bias was significant. Then we found the various factors affecting the heterogeneity, and when we taken care of the confounding factors responsible for heterogeneity via mathematical method, we could see that publication bias was nullified. So, here we can say the difference in effect was actually due to confounding factor, and that was given a picture similar to publication bias. But basically, this is a publication bias. The funnel plot is a crude measure of publication bias, where it's a reader's interpretation. Eagle's test will give you the exact p-value of publication bias. Now, another thing, random effect versus fixed effect models. There are two popular statistical methods for meta-analysis. One is fixed effect and random effect. Fixed effect model, that we explained earlier, and I will explain you in specific terms. That is, we assume that the one true effect size that underlines all studies in the analysis. All the difference observed between the effects are just a sampling error. Otherwise, effect size is similar across the study. The little bit difference are just due to samples. It is used when your probability of true heterogeneity is less. What is random effect model? Random effect, we assume that the true effect size randomly vary across the studies. For example, the effect size must be higher in studies where the participants are older or more educated or healthier than the other studies, when a more intensive variant of intervention is used. The term random reflects that the studies included in the analysis are assumed to be just a random sample of all possible studies that meet the inclusion criteria of review. Here, we took the 10 studies. That means that we have created an imaginary population of the study and included a random sample of their study population. I hope you understand that. Here, we use plural effects since we are working with multiple true effects, generally used when I square or probability of heterogeneity more than 40%. So this was the basic difference between fixed effect and random effect model. I am not going into the various mathematical complexity of various random effect models like Disarman-Leonian or restricted multiple likelihood analysis, and there are various analyses, there are softwares for it, there are mathematical method for it. This is the just to understand the what is fixed effect meta-analysis and what is random effect meta-analysis. Meta-regression. Now meta-regression are defined as to be a meta-analysis that use regression analysis to combine, compare, synthesize research findings from multiple studies by adjusting the effects of available covariants on a response variable. In simpler terms, meta-regression can be used as univariate and multivariate analysis. Basically, these are the confounding factors which are affecting your effect size. If you are studying the postoperative mortality, one study included only more than 80 years or octogenarian patient, another study less than 50 years or young patient. Of course, the mortality in older generation will be higher than the younger generation. So here, age is the confounding factor which is giving rise to the heterogeneity in the effect size. Whether age is independently predicting this difference in effect size between two studies and hence indirectly responsible for mortality, that is generally analyzed by meta-regression analysis. Now there is a dictum that generally 10 studies are needed to do a meaningful meta-regression analysis. This is one of our published studies in which studied the impact of neoadjuvant chemoradiotherapy in postoperative clinically significant pancreatic fistula. Here we could do meta-regression analysis of only one factor, blood loss, because it required minimum 10 studies. Here you can see the circle representing the various amount of blood loss across the studies. You can see the blood loss may be lower side or higher side. Still, the summary of effect, that is center line, is just a summary of effect. You can see it is the log risk ratio versus the blood loss graph. Here you can see the summary of effects remains static in spite of different blood loss. So blood loss was not predicting the heterogeneity and my finding was non-significant. There is another studies, postoperative mortality of the liver resection, that we studied earlier. There was a huge publication bias, significant heterogeneity, as you can we have seen in earlier forest plots. You can see the various factors. Here we did the both univariate and multivariate analysis. All the factors which were significantly predicting heterogeneity, indirectly mortality, or different in effect size across the study, we included in our multivariate model. And you can see the multivariate p-value. We found that major hepatectomy, open surgeries, and colorectal liver metastasis, surgery done for colorectal liver metastasis, was responsible for heterogeneity. Colorectal liver metastasis patients are generally having lower mortality than the patient with HCC. So what do we found? European cohort, which include majority liver resection for colorectal liver metastasis, had lower mortality in liver resection studies compared to say Korea or Japan or Asian studies, India, because they are do liver resection more for hepatocellular carcinoma than colorectal liver metastasis. So definitely they were having higher mortality. So mortality in Korean studies were different from mortality in European studies. The factor responsible, one of the factors was etiology, and that is why it was predicting the true difference in effect size or heterogeneity. Another finding was major hepatectomy. Open surgery was showing worse result than the laparoscopic surgery. Cirrhotic, as we discussed, cirrhotic liver were having higher mortality. So studies which included the more number of cirrhotic patients was having bad result compared to studies which included less number of cirrhotics. So I think you are getting what the meta-regression analysis. Meta-regression analysis is just like the logistic regression or any regression analysis with what we do in our original studies or population based studies. But here we see the whether those factors are affecting effect size across the various studies or not. So that is the meta-regression analysis. Now let us see in last two slides how to analyze meta-analysis. First, start with understanding the research question. No studies can be understood without understanding the research question. What the author actually want to know. Right? Then all the steps of systematic reviews are properly followed or not. Which search, what words are used to search studies, whether those keywords were adequate, whether those keywords used to search the study helped in identifying all possible studies, whether optimal literature search are carried out or not. There are specific guidelines for that. You can see the PRISMA guideline, that is the preferred reporting of systematic review and meta-analysis guidelines 2020. Then inclusion and exclusion criteria of the studies. Which studies were excluded? Are there any important study excluded? All or majority of important study which is in sync with your research questions are included or not? Summary of bias, whether authors have evaluated each study and stated that according to him which studies are biased and which are not. Summary of bias is generally author's judgment. There are specific tools for that. Cochrane gives tool for randomized control trial. Then there is a Newcastle-Ottawa scale for assessing bias in cohort study. But basically it's an author's judgment. Authors can do meta-analysis in two ways, whether they exclude the study with high chances of bias and include studies with low chances of bias, or sometimes they can include all the studies but stating that these studies they feel has higher chances of bias and that bias may affect their summary effect. There are specific guidelines for doing that meta-analysis and systematic review. That is the Moose guideline, that is the meta-analysis or observation of observation studies guidelines, and Cochrane handbook. Now see weight of the study, whether one study is responsible for all the summary of effect or not. For example, if you do meta-analysis of two studies, one with 1000 patients, another with 25 patients, understand that you are not doing any meta-analysis because all the effect will be similar to that 1000 patient study. Then we have already discussed analyze heterogeneity, whether it is true or random, why this heterogeneity arises, why studies were showing different effect size, whether appropriate model was used or not. You cannot use fixed effect meta-analysis in studies which were showing very high heterogeneity. Publication bias was assessed or not. If there is a heterogeneity in the studies, whether confounding factors were evaluated or not, or it was possible to evaluate confounding factors or not. Remember, meta-analysis is just a summary analysis or statistical analysis of all the study published. If primary authors in included studies did not mention the confounding factors, then there can be a many hidden confounding factor for heterogeneity with which researchers which are doing meta-analysis cannot analyze. So these are the inherent limitation of meta-analysis. So this is how you analyze meta-analysis. I hope you can now read the forest plot properly, understand the meta-analysis properly. Thank you very much.